गुड आफ्टरनून. कसे आहात सगळे? 15 लाईव्ह आहेत. हॅलो. हॅलो एव्हरीवन. नमस्कार. 37 लाईव्ह आहेत. कसे आहात सगळे? सगळी नर्सिंगचे क्वेश्चन्स आहेत, आपण सॉल्व करूया. विच ऑफ द फॉलोइंग इज नॉट ए कॉम्प्लिकेबल ऑफ ॲक्यूट पॅनक्रियाटायटिस? Which of the following is not complications of acute pancreatitis? Is in A. increased ICP, B. ascites, C. splenic vein thrombosis, and D. renal dysfunction. पॅनक्रियाटायटिसचे कॉम्प्लिकेशन कुठलं नाही आहे. असायटिस आहे, रिनल डिस्फंक्शन आहे आणि स्प्लेनिक वेन थ्रोम्बोसिस पण आहे. इन्क्रीज ICP नाही आहे. सेकंड क्वेश्चन आहे, फ्लूइड व्हॉल्यूम डेफिशिट इज मोस्ट लाईकली असोसिएटेड विथ विच ऑफ द फॉलोइंग कंडिशन? A. pancreatitis, B. congestive heart failure, C. gastritis, D. appendicitis. Pancreatitis. Nursing management of the patient with acute pancreatitis include assess for hypocalcemia, treat hyperglycemia based on insulin sliding scale, both A and B. D is provide enzyme replacement. its answer आहे both A and B, means C. नेक्स्ट क्वेश्चन आहे, complication of chronic pancreatitis include the following. Complication of chronic pancreatitis include of the following. A is deficiency of fat soluble vitamin, B pseudocytosis, C diabetes mellitus, and D all of the above. ड्रग चॉईस ऑफ पेन कंट्रोल इन ॲक्यूट पॅनक्रियाटायटिस. ॲक्यूट पॅनक्रियाटायटिसमध्ये कुठला ड्रग देतो आपण, मेडिसिन देतो? तर ए आहे मॉर्फिन, बी आहे डायक्लोफेनॅक सोडियम, सी आहे मॅपिरिडिन, डी आहे एंडोमेथॅसिन. आपण कुठलं ड्रग देतो? क्वेश्चन राहिला. पॅनक्रियाटायटिस क्लायंट manifest with the medigastric pain, abdominal bloating, nausea and vomiting, all of the above. All of the above. Drug of choice for pain control in acute pancreatitis is morphine, diclofenac, mepiridium. 21 आहे, पर्पस ऑफ कंटिन्यूअस लो एनर्जी ड्रेनेज इन ए क्लाइंट with pancreatitis to prevent GERD, abdominal distension, pancreatic stimulation, intestinal obstruction. Pancreatic stimulation. Which among the following food type need to be restricted in a client with pancreatitis? Carbohydrate, fat. All of the following are cause of constipation except constipationचे cause काय आहे तर इनएडिक्वेट फायबर इंटेक आहे, फ्लुइड इंटेक आहे, डिक्रीज गॅस्ट्रोइंटेस्टायनल मोटिलिटी आहे, लॅक्सेटिव्ह नाही आहे. सो ॲक्सेप्ट विचारलं आहे. A client is scheduled for hemorrhoidectomy. The nurse should observe the client for the presence of which common clinical indicator associated with hemorrhoids. Is pruritus, B. flatulence, anal stenosis and rectal bleeding. Hemorrhoidectomy आहे पेशंटची. सो आपण बघितलं पाहिजे rectal bleeding. Next question आहे, which of this patient dietary habit does the nurses understand may increase the risk for development of colon cancer? Which dietary habit does nurse understand may increase the risk for development of colon cancer? High fat, low fiber intake. High intake of milk and milk product, low meat and protein intake, low fat and carbohydrate intake. High fat and colon cancer of the large intestine. High fat and low fiber intake may contributed to an increased risk. The nurse is reinforcing patient teaching. Which of the following food would the nurse enforces that the patient with ulcerative colitis should avoid? Fresh fruit. Fresh fruits are high in fiber and notable for causing gas. Notable. Which of the following statement regarding diverticulitis is true? Abdominal pain, fever, nausea, and a change in the bowel habit are the sign and symptoms. Diverticulitis is the most common in sigmoid colon. Treatment can include rest, egg, liquid, or high fiber diet. All of the above. The answer is all of the above. A companion diverticulitic patient with the diverticulosis has rectal bleeding, no symptom, localized cramping, pain, abdominal distension, no symptom. An abdominal sac or pouch form at a big point in the wall of alimentary tract is aneurysm, diverticulum, hernia, and protrusion. So it will be diverticulum. Inflammatory bowel disease result in perforation, structural obstruction, and paralytic ileus. Inflammatory bowel disease result in perforation. After a surgery for an ileal conduit, a nurse should closely evaluate client for which complication? peritonitis infection, thrombophlebitis, and hematuria, her infection. Following fibroptic colonoscopy patient report increasing abdominal pain, fever, and chills. Which among the following complications need to suspect by the nurse? Bowel perforation, pneumoperitoneum, paralytic ileus, and diverticulum. Is bowel perforation. Correct information regarding colonoscopy is informed consent is necessary. Sedation may be used during the procedure, and NPO status is needed, and D is all of the above. Correct information regarding colonoscopy, all points. So D, all of the above. In gastrointestinal perforation, nurse need to suspect for what dash. The A is paralytic ileus, B is McBurney's point pain, sudden severe abdominal pain, D is diarrhea. In gastrointestinal perforation, nurse should suspect. The answer is sudden severe abdominal pain. A ganglionic disease of the intestinal tract which cause inadequate motility is termed as ulcerative colitis. Corn disease, Hirschsprung disease, and diverticular disease. Hirschsprung disease. The corrective surgery for Hirschsprung disease is pyloroplasty. Psi procedure, duomal procedure. Current jelly stool is manifestation of tracheoesophageal fistula, intussusception, esophageal atresia, anorectal malformation. इंटरसेप्शन मध्ये करंट जेली लाइक स्टूल पास होते हैं. Current jelly like stool containing the mucus among 3 months to 3-year-old child is suspected to have intussusception. Which of the following is manifestation? Which of the following corn disease most commonly affect the ileum? Which of the following is earliest manifestation of corn disease? Deep ulcer involving GI mucosa, aphthous ulcers, cobblestone, apparent discontinuous involvement of ileum. Aphthous ulcer. Which of the following bowel disorder is commonly associated with fistula? Diverticulitis, appendicitis, irritable bowel syndrome, corn disease. Cone disease. The development of diverticulitis is associated with which of the following type of diet? High fiber diet, low fiber, low fat or protein rich diet? Which type of diet? Low fiber diet. A 55 years old male is admitted with a diagnosis of Crohn's disease. The nurse knows that the most common location of digestive tract affected by Crohn's disease is terminal ileum. Which of the following symptoms is likely to be exhibited by a patient with Crohn's disease? Is steatorrhea. Pain associated with irritable bowel disease can be treated with pain associated with irritable bowel disease can be treated with steroids. Rectal bleeding is the predominant symptom in which of the following condition? Rectal bleeding is a predominant symptom in which of the following condition? Ulcerative colitis. Purpose of ileostomy in ulcerative colitis is to prevent possible perforation from colitis. The nurse is aware that the most common assessment finding in a child with ulcerative colitis is profuse diarrhea. All are the true about ulcerative colitis except it is highly associated with infertility is wrong. All are the true about ulcerative colitis except rectal bleeding is less as compared to Crohn's disease. What is true about ulcerative colitis? In ulcerative colitis involves rectum and then whole colon backward. A client is admitted to the hospital with a bowel obstruction. Which of the following is the priority nursing diagnosis? Fluid volume deficit. Because bowel obstruction result in accumulation of feces, fluid and gas above the obstructed part. This causes decreased fluid absorption, hence fluid volume deficit. Absence of bowel sound and abdominal distension after abdominal surgery. It indicates paralytic ileus. Paralytic ileus is the occurrence of intestinal blockage in the absence of an actual physical obstruction. A temporary paralysis of a portion of the intestine occurs typically after an abdominal surgery. Colostomy and ileostomy questions आहेत थोडे. To perform colostomy irrigation, the catheter should be inserted into the stoma up to 10 cm. Most common site for intestinal obstruction is ileum. Which among the following is a treatment option for intestinal obstruction? Is decompress the bowel and resection and anastomosis. So both A and B. Leading cause of small intestine obstruction is adhesion secondary to previous pelvic surgery. While doing colostomy irrigation, the irrigation bag should be hang dash dash above the level of the stoma, 12 to 18 inch above the level of stoma. There is no drainage from colostomy. Explanation आहे आधीच्या क्वेश्चनचं. The irrigation bag should be hang 12 to 18 inches irrigation bag above the level can create the increased pressure and sudden intestinal distension to the patient. The next question is, there is no drainage from colostomy after 24 hours of its creation. Nurse should aware that it is because of absence of gastrointestinal motility. Maximum normal functioning of the bowel will be present in sigmoid colostomy. Solution of choice for colostomy irrigation is tap water. Among the following which must be there in the discharge teaching plan of a permanent colostomy client? Dilation of the stoma. Patient with colostomy should be advised to eat everything they ate before the surgery, but will avoid those food that produce gas.